If you're a beekeeper, you've probably heard of a parasite called a Varroa mite. Varroa is the most damaging parasite of Western honeybees and has been identified as the main cause of overwinter colony mortality in northern climates. It is vital that beekeepers manage Varroa levels to prevent them from causing low production in colonies and, in extreme cases, colony collapse. Varroa mites latch onto and feed on honeybees, causing immunosuppression, which lowers the bee's ability to fight off disease. Unfortunately, this can lead to death. In the past, and in many cases still today, farmers relied heavily on agrochemicals to control crop pests. While these chemical-reliant solutions did a fine job of protecting crops from a wide variety of pests and diseases, they did so at the expense of environmental health, safety for the farmers, and increase the risk of producing pesticide-resistant pests. Fortunately, there has been a shift toward a different management strategy that relies on preventative and careful decision-making to minimize damage to both the crop and the environment. This strategy is known as Integrated Pest Management and relies on awareness, identification of the pest, monitoring pest population, determining an economic threshold, finding the best management or treatment option, and evaluating the success of the IPM program. IPM strategies have been adopted to control Varroa levels and rely heavily on mite monitoring to identify thresholds of interest. There are two thresholds to note. One, the economic injury level, which refers to the lowest number of mites that will cause economic losses to the beekeeper, for example, by reducing honey production or losing a viable colony. And two, the economic threshold, which refers to the level of mites at which management action is needed to prevent the mite population from reaching an economic injury level. Currently in British Columbia, the economic threshold for Varroa mites is 3%. This means that if for every 100 of your bees there are 3 mites present, you should start looking into treatment options. However, there is an increasing concern worldwide about revising this economic threshold as we begin to see how much climatic conditions, viral diseases, and other factors can contribute to the high virulence and impact of Varroa mites on bee health. The goal of our study was to revise the current economic injury level in Western Canada and propose an amended value to more accurately determine when intervention is needed by beekeepers to reduce mite levels. By monitoring Varroa mite levels in 183 colonies from 5 different regions in British Columbia, we found that colonies with greater than or equal to 1% mite infestation in the fall had a significantly higher mortality rate in the spring compared to colonies with less than 1% mite levels. Based on these results, this study offers a revised economic injury threshold of 1% and suggests that beekeepers should use genetics, cultural and mechanical methods, and adequate treatments to prevent Varroa levels from reaching 1% by the late summer or fall. Implementing this change could be vital in creating an effective IPM strategy against Varroa. Varroa mites are one of the primary causes for overwinter mortality in honeybee colonies, but with frequent surveillance, mite monitoring, and the adequate use of treatments, we can manage this pest, keep their population below harmful thresholds, and have healthy and productive honeybees.